Hi, my name is Evan Andreo. Today I'm going to talk you through the SenMoCOR joint position error test using the head to neutral test. Let's talk through the setup first. It's important to have your patient seated about 3 feet away or 90 centimeters from the wall and target. Ideally, the target is positioned at about eye level to the patient. You want to try to have the patient in a high back chair. This makes so that whenever they perform rotation, as little movement comes from the back and most of it comes from the cervical spine. From this position, ideally the patient is seated comfortably and doesn't have to force their neck into any specific positions. We're going to be using the SenMoCOR JPE laser. For this, we're going to have an adjustable strap in different positions to make sure that we can get it right on the target's center. All right, Cynthia, I want you to go ahead and put this on your head here for me. Ideally, you have the laser in the front of your forehead, and the strap should be comfortable around the back of your head. If we need to, we can adjust the tension with the strap in the back. Does that feel okay?
Yes.
Great, so just make yourself comfortable. I'm going to go ahead and turn on the laser. Don't move your head position. I'm actually going to move the laser so that it's right in the middle there. Good. Is that okay?
Yes.
Great, we're all set. Okay, so we're going to walk through the test. Let's just do a practice run so you get an idea of what to expect. We're going to do several trials, all turning to the left for this first bout. What I want you to do is try to turn to the left as far as you comfortably can for me. Let's go ahead and do that. And come on back to the center. So that's essentially the movement we're going to be doing for 6 trials. I need you to do this with your eyes closed and hopefully keep your eyes closed for the entire duration of the test, okay? As you do that, you're going to go out as far as you can, and when you come back to the middle, just say when you think you've gotten to the middle, say okay or yes or something like that. I'm going to put an X and mark where you are, okay? After that's done, I'm going to have to reposition your head so we can get it back onto the center. It's normal to be a little bit off as you go through these trials. Ideally, we're trying to stay within the blue ring, but as you go through this, please don't open your eyes until we're done with the whole test. Sound good?
Yes.
Okay. So what I want you to do first is go ahead and close your eyes. We're going to go ahead and turn to the left as far as you can. Ideally, the patient's able to turn as far as they comfortably can. Go ahead and turn back to the center. And they're getting a similar amount of range of motion through each trial. Go ahead and tell me where you feel like you've got to the center.
No.
You want to try to reposition them back to the center. I'm going to reposition your head. I'm marking right whenever she verbalizes okay, so that I can get a measure of where she thought she was. Let's do one more trial. We're demonstrating 6 trials today. This is going to be dependent upon what the patient can tolerate. Some may not be able to tolerate a full 6 trials. You can ideally try to get 6, but if not, 3 is an acceptable amount.
Okay.
All right, Cynthia, you can go ahead and open up your eyes here. Well done. So ideally, we were trying to stay within this ring, and you did a great job for today's test. So now that we've gone through 6 trials, I just want to write down how far she is from the center of the target. I'm just going to turn the laser off here for you. You can just relax. You can do this in a couple of different ways. We have it set so that you can write down centimeters from the center of the target, or you can choose to write down degrees. We know that 4.5 degrees or 7.1 centimeters is our threshold. The 4.5 degrees is only going to work if they're positioned about 3 feet away from the target. I'm going to choose to write this down in distance in centimeters. So I'm going to try to round it to the closest border. So my first measure here is 7.1. Our next one will be 4.7. This one, 4.7. 4.7. Next one's at 4.7. And our last one's a little closer to 7.1. And then what I would do is take those measures and take an average of all of them. So now that we've completed one movement direction, ideally we're going to move on to the others for right rotation, flexion, and extension. So Cynthia, excellent job on that first one. What we're going to do is do that again for a couple of different movements. Turning to the right, looking up, and also looking down, okay?
Yeah.
So before you start, you want to just erase the marks. Otherwise, there gets to be way too many X's on this target. I've already written down my results, so I can move on to the next one. Great. Now what we'll do is take all of these and we'll do a calculation just to get the average of our distances. Again, I chose to write this in centimeters. You could write this in degrees, assuming the patient's at the right position. So now that we've finished our test, let's try to interpret the results. You can see for this particular test, we wrote down the distance from the center of the target in centimeters. And what we did is we took an average, right? So for that average, we identified what's going to be the average for each specific movement. So you can see for left rotation, right rotation, flexion, and extension. In this particular circumstance, what we're trying to see is the distance is less than 7.1 centimeters from the actual center of the target. Again, this is made with versatility. You can use the distance in centimeters or the degrees, assuming the patient's position's at the right distance from the target. In this particular test, she passed. She made it in less than 7.1 centimeters for every single direction. Ideally, they try to get within that threshold, but if they didn't, that's a number that's strongly correlated with neck pain and cervicogenic dizziness. It's a good indication that we should probably pursue treatment. What I'm going to do is explain that result to Cynthia. All right, so we made it through the whole test. Let's kind of talk through how you did. For all of those different movements, we tried to do several different trials just to get a good general idea of how well you can position your neck back to the position that you started in. That tells us how well your neck can sense movements and hopefully get back to the position it's supposed to be at. It's really important for all day-to-day functions, how you use your head, your neck, and how you move. You can see here, based off of your averages, we're getting 5.5, 6.1, 5.0, 5.8. There's a lot of research that shows if you're beyond 4.5 degrees or 7.1 centimeters from the center, it's something that just tells us that we probably need to pursue treating for your neck to try to get that better, which is great because that's something that we can do. But fortunately, in this particular test, you passed the test. You made it in less than 7.1 centimeters, so well done. So now that we've completed our test and we've looked at our results, let's go over a few key considerations as you're reviewing everything. A few things to consider is how the patient moves. So as you're looking at the movement of the actual individual, movement speed does matter. Some patients may be inclined to move very quickly through the test. Ideally, they move fairly slow. The faster they move, the more it's actually going to stimulate the vestibular system, and it's less of an isolated test of joint position sense. Another consideration is using your results not only as a threshold for 7.1 centimeters, but also for testing and retesting the measure. The benefit is you've identified a threshold, but you've also have a testing number that you can then actually take the test again and remeasure and compare. So if they've got 7.1 centimeters in my first test, I can then compare and hopefully they get lower after treatment. One last consideration is the number of trials you're actually going to do with the test. I know 6 trials for each of these movement direction feels like a lot, and it is, but that's the ideal to be able to enhance the reliability of the actual test and get a good average for each movement direction. That said, individualize it to your patient. If they can't tolerate that many movements because it's causing too much discomfort or it's putting too much movement through the cervical spine, you can choose to do less trials. For example, only doing 3 trials for each movement direction. Another consideration is only doing a certain number of movements for each test. For example, in an individual test, you may only go through right rotation and left rotation and choose to do flexion extension at a later time, or only pick movement directions that are correlated with the other measures and tests that you did for your patient. I hope this adds clinical value to your practice and you can enjoy using this test.